In India, healthcare ecosystem is expanding noteworthily as the country endeavors to provide healthcare to all. However, there are a few shocking facts to note as today's focus remains vascular and endovascular disease. With a population of nearly 1.46 billion, India is witnessing a sharp rise in cardiovascular diseases, diabetes, and peripheral artery disease, placing an increasing burden on its healthcare system. The demand for endovascular treatment is growing rapidly, particularly among individuals aged 60 and above, and those with risk factors such as diabetes, hypertension, high cholesterol, obesity, chronic kidney disease, tobacco use, or a family history of vascular disease. Today, coronary artery disease, stroke, and peripheral artery disease account for the largest share of endovascular procedures in India, reflecting the country's escalating vascular health challenges and the critical need for timely, minimally invasive interventions. Well, there have been effective developments in the vascular and endovascular field basis this increasing demand. So people, let's not miss out the fact that every heartbeat depends on a healthy vascular network. From restoring blood flow to preventing life-threatening complications, endovascular surgery has revolutionized the treatment of vascular diseases. So to explore how vascular and endovascular surgery is critically advancing the future of circulation, recovery, and patient care, today we have Dr. Sunder Narasimhan with us. Dr. Narsimahan is a highly skilled vascular and endovascular surgeon based in Bangalore, Karnataka, with over 23 years of extensive experience in his field. So let's hear from the expert about this life-changing specialty. So first of all, Dr. Narasimhan, what inspiration led you to specialize in vascular and endovascular surgery?
What led me to vascular endovascular surgery is actually a mystery. Basically, I did my MBBS from Bangalore, and then I did my Masters in General Surgery from St. John's Medical College, which is one of the best medical colleges in South India. After I finished my Masters in Surgery, I got selected as a junior consultant, and then I started working in the same institution where I trained, and we used to do a lot of emergencies. One particular day night, what happened, our own hospital staff who's working as a research assistant to our hospital dean, she was wheeled into the emergency following the trauma which she sustained, and it was a day which was heavily raining, and the matador had smashed her, and then she was going on a two-wheeler with her husband, and she was a pillion rider, and she sustained injury. She sustained fractures to her lower limb bones, and when we examined her, her foot was very cold. Her foot was not getting enough circulation, especially the arterial circulation. At that time, we rushed her to theatre, and we did a vascular injury repair. Not me, but by my senior colleague surgeons. I know everything seemed okay, and then that they all were sort of little uncertain whether the circulation is happening properly or not, but we kept checking. But finally, after 3-4 days, all of them got to the conclusion that there was no blood supply happening, and finally then we had to amputate her leg. Foot went into gangrene. That particular incident actually moved me a lot, and that day I decided that I have to get trained in repairing the blood vessels. And to achieve the same, then I went to Delhi. I got trained under Dr. Lieutenant Colonel Kumud Roy, who was an established vascular surgeon there. So that is how I actually got to train in vascular surgery. I wanted to become a vascular surgeon. And then after that, my endovascular training, actually, I was always keen to further hone my skills. Open vascular surgery is good, for certain conditions. The major complex patients, we need to, kind of embrace minimally invasive techniques. So for that, the facilities were not available in India. So I kept on, attending all the conferences abroad, and then I got inspired. Then I went abroad. I went to London and I went to Germany, and finally I landed up in Australia. That's where actually my endovascular training happened, and the foundations were laid very nicely there. And then after an extensive training and exposure, then I came back to serve my country.
So right now you told about different techniques used for the vascular and endovascular surgeries. So how do you think these developments have improved the patient outcomes today?
Earlier, vascular surgery means we used to actually do bypasses. We used to make big cuts, and we used to also do these procedures under general anesthesia, and very rarely spinal anesthesia. But general anesthesia has its own set of complications. Not everybody's lung is good, not everybody's heart is good, and many people with who come with vascular disease, they're all 50 plus age. But then when we make big cuts and all, the wounds we have to deal with, it doesn't heal, and it gets infected. Sometimes when the wound is infected, when we have done the anastomosis where we join the arteries together and the graft, it can blow up and can cause bleeding. So all these potential complications of anesthesia, general anesthesia, spinal anesthesia, plus wound complications, and also that grafts getting clotted, all this, they're all prevented by now embracing endovascular techniques, because which is done through a very small hole, which can be done under kind of a local anesthesia, and patient is kept away. And despite the bad the lung condition, the bad heart condition, because it is a small hole, maybe a 2 millimeter hole or 3 millimeter more, or at the most 4 millimeter holes, and through which we send wires and catheters, and then we perform the endovascular procedures with the help of balloons and sometimes with the help of stents, and the procedure at the most takes about max to max about 3 hours to 4 hours. But we do it very slowly, we do it very carefully. We do it with the help of, we do all this procedure, both open as well as endovascular can be combined together, and we do. So we have a hybrid lab. So it is a image guided procedure. So exactly, you can quantify the disease exactly while you are doing the procedure, because you are taking the image of the blood vessel and then you are acting on it. So whether it is a single spot or multiple spot, and what is the complexity of the disease, all that you get to know, and then you can with the help of the endovascular hardware devices, we can achieve the very good outcome, and patients can get home faster, maybe at the most 2 days following the procedure, they are back on their feet, they can walk, there's no need to take rest, and they will be kept on blood thinners, so outcomes are generally good.
Great, great. So what are some of the most common vascular and endovascular conditions that you come across in your practice today?
Most common vascular conditions is, I would say, the varicose veins, which affects all the people from the most young to the old people. And we earlier we used to do open procedures like ligation and stripping and all. Now we no longer do that. We do a laser therapy, or we do a frequency ablation therapy, or we do the glue therapy, which are all done through again small holes. Following the procedure, they are able to get back to normalcy. The common procedures what we do is that a diabetic foot arterial disease, where people come with gangrene, ischemic ulcers not healing in the foot, and sometimes the infected foot with septic gangrene. The diabetes is very rampant in our country, and most of those patients, at least 60% of those patients with diabetes, they go through diabetic foot related issues, especially the problems with the circulation in the foot. So we do what we call it, angiogram, and first to take the image of the blood vessels, and then we do angioplasties and improve the blood flow to the foot, and then whatever the foot is infected and the dead tissues we remove, and minor amputations like toe amputations we save the foot from major amputations like below knee and above knee amputation, so they are back on their feet. So the other thing what we do is all patients who come with the clots in the veins, which we call deep vein thrombosis. The clots can sometimes migrate to the lungs, which we call pulmonary embolism. So how do we treat this condition is that first is we make a small hole in the leg, in the neck, and we go down and we put a filter so that the veins from the clots in the veins in the lower limbs does not go any further. Then we go with a catheter to the lung artery, and then we instill all the blood clot dissolving agents, and then after that we have a special catheter. That catheters can suck out all the large volumes of clot, and immediately the patient can breathe, and they come back to their life. Because of this lung clots, the heart also fails, heart also recovers. So this is again a minimally invasive procedure, and we do lots of other procedures, like which is even for aneurysm of the aorta, where there is a localized the dilatation of the aorta, where because of the pressure which builds in the aorta enlarges like a balloon, and then we call it aneurysm, which can rupture, which can bleed. With this also we do a endovascular repair of the aortic aneurysm using minimally invasive techniques. Plus, we do hosts of other operations.
So, doctor, patient awareness regarding the endovascular and vascular surgeries is still evolving in India. So, what are the common misconceptions that people still have when they come to you regarding endovascular and vascular surgeries or diseases? And also, how are you invested in educating them about the treatment and diagnosis process?
So, our country is diabetic capital. I think by around the age of 40 years, I think at least 30 to 40% of our population, they have diabetes. So most of these patients, when they are diagnosed with diabetes, they are not aware about certain vascular complications which can arise in them. And I feel that the physicians, they have a major crucial role in getting them to know that look, you have diabetes, you are likely to have heart disease, you are likely to have blood vessel disease which are going to the brain, you're likely to have blood vessel disease which are going to the kidney, lower limbs, and all that. As far as the awareness is concerned, I think there are a lot of digital medias and of course the newspapers and all that, which covers some of this vascular disease. But we have a day called Vascular Day, which falls on the August 6th every year. So we do a walkathon and we do all that awareness programs, how to prevent the amputations in the limb, how to stay fit, all that, the risk factors and which are likely to cause all the vascular diseases. We can show up with the banners and all that, and I think it is improving now compared to what it used to be about 10 years back. But still, I would say there is a long way to go.